All right. Well, hello everyone, and thank you for joining us. We are so happy to have you guys here for our first quarterly meetup of the year. Liz, can you keep an eye on the waiting room just in case someone else joins? Thank you.
Sure.
We'll take turns there. We have had a busy 3 months here since we talked to you guys in December, and we have a lot of exciting things that we're gearing up for here in 2025. And so we have a few slides here to share with you and some announcements too. And so I will go ahead and get on to things if I can find my mouse. There we go. So our team is expanding here. I've been with the organization, well, since its founding. So I'm the executive and co-founder of HCU Network America, and now this is my full-time job. And then a couple of years ago, about our 2022 conference, Liz joined us originally as our communications manager, but she has shifted her role a little bit here to our advocacy manager and outreach coordinator. And then this in January, Brittany Park started as our research coordinator. If you've attended our conference, you'll have met her. She was originally the chair of the remethylation disorder, so our cobalamin and severe MTHFR community. And we are so excited to have her on board as part of the official team here. And then we also, as Liz was shifting her responsibilities, we did hire a part-time marketing coordinator, Gabby, who's also part of our community. And so you'll be seeing more things from them in the community as things roll out. And so just kind of recapping here, our areas of focus. We have our community support. This will be actually eventually developing here into a committee. And then Liz is heading advocacy and awareness, and she'll be talking a little bit about that. And Brittany will be leading research. And then we have our fundraising committee as well. And then as things come up, we do have resources that help inform and provide resources for patients and families. And I realized just now we forgot to, but I can squeeze them in along the way here. Um, and so first up is community engagement. And so we've been working on some things behind the scenes. And we are excited to announce our first summer regional meetups. We have two this summer. We have one in Florida, June 7th, and one in Texas, June 28th. And those are welcome to anyone in the community. One of the things that I try to do also as I'm traveling is to meet up with any families, either that come through Illinois or while I'm on the road. And so Adam, one of the adult patients in our community, was in Chicago last week. So we had lunch together. And next month, well, later this month, Liz and I are off to Los Angeles. And then next month, Brittany and I are off to San Diego. And so while we're there, we're also going to be meeting up with some families in those areas. So if you happen to be in Los Angeles or San Diego, please reach out. We'd love to catch up with you as well. To register for our summer regional meetups, there's a QR code here, and there is the Pledge It link. And if you go to our socials, it's easily findable there as well. And then one of the updates we have here is Brittany has taken on revamping our pharmacy, compounding pharmacy list. This really applies right now to those on hydroxycobalamin. And so she has done a really fantastic job going through the list that we had existing. And we made this a little bit easier to sort. There's some columns that got cut off just because it's huge. It's actually a spreadsheet you can view online, but it sorts it by state. It gives you the phone number and the website and the name of the place. What's also on there that you can't see here is also the the dose of it that they can carry up to. And so we do have an international link as well. Um, One of the things that I forgot about that I'm really excited about actually is we have translated our cobalamin guide into Spanish. We had our old cobalamin guide translated into Spanish, but our new one that we put out a couple years ago has also been translated, and our classical HCU guide has now been translated into Arabic as well. So those resources are on our website. And then we have dates for the rest of our virtual meetups for the year. The next one is June 1st, followed by September 21st and December 14th. And so you'll see those posted online. If you get our events emails, you'll get them there as well, but there's also a QR code here as well. And then Liz, you are up.
Okay. Can I click? No, you'll click for me. Okay.
Yep, there we go.
That's perfect. All right. So, recap of the past couple months. As you guys likely know, February 28th was Rare Disease Day. It's always the last day of February. And one of the big annual events that's hosted is Every Life Foundation's Rare Disease Week on Capitol Hill. And so a couple of us from the community were able to make it this year. As you can see, Grace here on the picture, Grace, who's here today on our call, Jamila, who is an adult patient in our community, and her dad, who looks like her brother, were also there. And then I took my mom this year, which was cool. It was the first time I had taken anybody with me. And so mom got to kind of see, she's a very active grandmother and helps me a lot care for Elliot. So it was cool to bring her and kind of introduce her to my world a little bit. And then Joanna here on the end from Oregon, who you guys all may know is an adult patient in our community as well. And as you can see, there were a lot of people there. There's usually around 1,000. I think this year was about the same. People from all 50 states and Puerto Rico as well, that come. And I can't recommend this event enough for anyone who has not yet had the opportunity, but considering doing so, because even if you never, participate in advocacy or policy advocacy a day in your life, Every Life Foundation makes it so easy and they prepare you so well. You have a whole day, the first day you arrive in DC, where they essentially just train you. They talk to you about the policy that is, on the table in the form of bills or upcoming bills that, will impact the rare disease community. This year it was, we talked to our elected officials about, the importance of Medicaid and not making cuts to Medicaid. We talked to them about rare disease priority review vouchers that help incentivize drug companies to develop therapies for rare diseases, and a couple other little things that were on the table. And so each person you go with the team from your state, and they curate the meetings for you. You have an app and it just tells you, okay, be at this office at this time, this office at this time. And you go around with your team and you talk to your elected officials together. And it is an incredible opportunity to kind of see how the world of, policy advocacy works, but also to meet people that you never would have maybe had the opportunity to meet otherwise. So for anyone who hasn't been, I highly recommend. Every Life always offers travel scholarships. They usually put out around December. And if you've never been, you should apply because they usually, you're very, very likely to get one. It covers $1,200 of your travel, which is, very, very helpful. So I just wanted to kind of give you a rundown of what that was like. And we had a great time and got to spend a little time with some people from our community, as you can see. And then Danae, if you will go to the next one, por favor.
I was just going to add where Every Life does provide training, so you don't go in there just like expected to know what to say. It's definitely intimidating, but I think once you get there, you realize it's not as scary as it seems.
Indeed. And it is one of those like things that you do and it's life-changing, really. Like you come home and you're just so on fire and rejuvenated and like you've made all these connections. And I just went to lunch this past week with I say girl, she's my age, but that I met there who lives in South Carolina that has chronic kidney disease. And like now we're connected and texting each other every day. So it's just a really cool opportunity. And then we had some really amazing community participation for Rare Disease Week on social media, because that is an incredibly important way to advocate and share our stories and spread awareness, which is the goal of Rare Disease Week. So just wanted to share with you guys a couple posts that we found. If you posted and we missed your post, we're sorry. We were scouring the internet trying to make sure we could include all that we saw, but really cool to see our folks from the HCU community involved in advocacy and sharing their stories. Danae, if I leave anything out, please feel free to jump
That's
in
okay.
as well. And then we're very excited because we are about to officially kick off our HCU Champion program. If you were at our family conference back in June in Colorado, we kind of announced this new initiative, and we are officially about to be underway. So we wanted to introduce you guys to our champions. These are a group of incredible people who are already advocates, actually, who have said, yes, I want to join and kind of band together with my fellow advocates and folks from our community and do this work together. So Brittany Hunter, I see, is with us today, and she is one of our amazing champions. We have Alex Levine, Gabby Lewis, Ben Massengale, Sam Stallings, Grace, who is also on the call today, and Aubrey. And so, yeah, we're going to start next week, actually. I need to get ready for that. We have a kickoff call where we're just going to get together and kind of just start the process of getting to know each other. Our champions are about to engage in their first training module, because the goal of the program is to build relationships within the community, but also to help people that are, interested in advocacy kind of take their advocacy journey to the next level. Because again, these are already incredible advocates, but we're going to provide them with some trainings and some things to ponder that will help them to just continue in their advocacy journeys, and then hopefully connect them to different opportunities to be advocates. So we're really excited about this incredible group and all the talent and excitement and all of that they bring to the table.
I'm just going to give a plug for a few of them right now. And so part of the Champions program is being able to find opportunities for them to share their story. And so last year for Rare Disease Day, Alex Levine actually went out to San Diego to Travere's headquarters and was able to share his patient story. He talked a lot about mental health. Dr. Al Friedman was also there. And then this year, Brittany Hunter was able to share her story with the Travere team as well. And so these are just a couple of opportunities. And then Grace, we invited her to attend Rare Disease Week on Capitol Hill. And so we really like to find ways to encourage the community, and these are fantastic opportunities and really go a long way. After Brittany spoke with the Travere team, I got several emails thanking me like I did anything, but they were just so enamored to hear Brittany's story, which if you haven't had a chance, you can see her daughter's story on our website. And but there's so much that we take away from each other, and the companies really also benefit from our champions as well. So there will be many more opportunities to come for them as well.
Indeed. So what is next? Well, we have World Homocystinuria Awareness Day, or the acronym that Danae just loves so much, which is WOD, which is coming up in May. And I know we'll talk later about that, about the opportunities to fundraise, because it's an important initiative for our organization and helping support our programs and all of that. But opportunities on social media to advocate for that one day. Again, it's May 18th. And it's our theme this year is Hope Connects Us Around the World. So we are really focusing on our global community, because even though we're called HCU Network America, we have patients and families from around the world who find us and connect with us. And we're so happy that they do. We want this to be a home for them too. So that is coming up. Just put that on your radar. And again, I know we'll talk more about that when we get to the fundraising aspect, but an opportunity to share, or to just post a little bit on social media or engage in different ways to spread awareness for homocysteinurias.
One thing I'll put a plug in here is on World Homocystinuria Awareness Day, we will have a live stream with a panel of guests as well. Liz and I are meeting tomorrow to discuss it in further detail. And so please pencil that in because I the conversation that we had last year with Shayna Shapiro um, and with Julia Sullivan. I know there was one more
Melanie
person.
Holter.
Melanie, thank you. Um, it still stands out so strongly in my mind, and we're going on a year. And I hear that so often from the families who've tuned in. And then Ben, who you saw on the previous slide, he runs the HCNU podcast, and he will be moderating that discussion. And so it's a really cool time for the community to kind of get to know a little bit more about each other. And we'll also be sharing patient caregiver stories from around the globe as well throughout the week leading up to it.
Yeah. So an easy way to plug in there if you see on social media our organization posting that we're going to have this panel, if you're comfortable, share that or just plan to join and watch the panel and participate in that. Okay. I don't know. Okay.
Oh, here comes Brittany.
All right, thank you. So part of my new role as the research coordinator is to really interact with the homocystinuria data collection program we have through RareX. And some of those aspects will include updating the community on this data, as well as taking that data and presenting posters and presentations at upcoming conferences. So here we have our kind of the map you've seen before of where across the world we have patients enrolled in the program. And so we have a very large international community, but obviously we want that to grow as well. And so I just kind of put on here different states in the US that we're still looking for patients to enroll. And obviously anywhere across the world we want to make sure are included as well. You can switch.
I was just going to add
Yes.
the best way for our community is if you have a friend within the HCU community that lives in one of these states, if you can give a direct ask to them, that is one of the most helpful ways we have found direct ask for our community has really helped grow the data collection program. And it helps you understand your child or yourself better. And so the more patients, the more caregivers we have, the better you will be able to understand your experience as well. Sorry.
Yeah. No, I agree. And I really want to shine a light on the fact that we want this population of data to fully represent the patients as our community as a whole. And one thing that I saw was, so yesterday I did an open hours for RareX where I'll hold in the future as well, just time for patients and families to log on and ask for help or navigate those areas. And one thing I noticed is that the demographics ethnically aren't very diverse. And so if you have friends, again, in, Spain or Portugal or anywhere that because I know that as members of the community, we talk to lots of people all over the place. We really want to make sure that we are really encompassing the demographics of the whole community. So.
And that will also help develop better therapies too. The more it truly is represented here. So,
Yeah.
all right. Sorry. I'll stop interrupting.
You're totally fine. And this happy little picture just kind of gives you an overview. We currently have 109 individuals enrolled. So a couple more since our last meeting. 77 of those are classical HCU, 37 are the Cabal-Mean disorders or severe MTHFR. And then I just wanted to highlight this last row of little people here. Only 72 of those 109 have completed the head to toe survey. So that's probably one of the most important surveys you can start out with. And now when you log on to the HCU network or HCU data collection program, it will actually prompt you to complete that survey before you can get to the dashboard. So once you take that survey, it will unlock other surveys of symptoms that you've noticed about yourself or your child. And so what we would really like to do is our ask is if you have enrolled in the program but not completed the head to toe survey, we want you to please update that. or go in and take it. And then if you haven't updated it within the last year, to go in and update that as well. Something that Danae and I learned that's actually really cool about this data collection program is that when you retake the head to toe survey, your previous answers do not get deleted. So what happens is it actually creates a longitudinal natural history study within our data collection program, which is incredibly important for accelerating research. And if we were to take a new treatment to the FDA, that information can be used to inform the FDA about our community's needs. So updating that head to toe survey, even if you've already taken it previously, every year is really, really important. So that's our big ask.
It's one of the best gifts you can give yourself or your child is just that gift of information. Because when we have this compared to say like the trivia or NIH natural history studies, these actually they have to have two sources of this information. So this can actually count, which I think might be your next slide here. So sorry for stealing your thunder.
No, totally fine. I mean, it's a great conversation. I get really excited about Rare X. I know Danae does too. And it really truly can accelerate and support our community when we're looking at trying to get FDA approval for new treatments. So it's so incredibly important. So of the 109 enrollees on the platform, we definitely need more. Our big push really is the completion of that head to toe survey. So with your permission, that de-identified data, so what that means is your data doesn't have any personal information on it. No one can go back and say this was Grayson's data, right? Like my son's. No one can identify that for when we pull it, we don't see any personal information. It's just the information on the surveys. So that data can help doctors, researchers find missing information so we can better understand homocystinuria and across the lifespan, like again, that longitudinal natural history study, provide better treatments, developing better therapies, and eventually what we really want to do is that finding the cure. So go ahead and go to the next one.
It doesn't matter where you are in the globe again, you can participate.
Yes, and I will say we have found a little trick recently. If you are not a native English speaker or reading English on a website, we have found a trick of how to translate it. So my email we can always drop in the chat as well. But it's research at hcunetworkamerica.org. If anyone needs help, then I'm always available. You can email me or come to any of the open office hours and I can help you kind of navigate the system. So again, looking at the data here on this slide, the 72 people who completed that head to toe survey, it's a very easy survey. Basically, you're asking yes and no questions. Does your child or do you yourself have difficulties in these different areas? And so the top 5 areas for that our patients are pointing to are vision issues, the central nervous system, or the brain, digestive issues, sleep issues, and then the bone, cartilage, and connective tissue issues. So you can see those are the top 5. And those are pretty consistently the top 5 issues that we're seeing. And again, that head to toe survey is really going to say, do you experience issues with your vision? You say yes or no. It's a very, very easy survey because then what happens is once you finish that head to toe survey, it might, for example, give you a more detailed survey about your vision. That's when you can go in and give more specifics about any difficulties you've been having. So,
And I have to say, even from my experience, like I feel like I know a lot, but I was surprised the different surveys that populated and what I kind of overlooked in just my mental thinking of what would show up. So even if you like I had central nervous system things show up in my dashboard that I didn't even think I that would, but how they group things together, a lot more gets encompassed. So
yeah, and I mean, I can say that there's been difficulties that Grayson has had, my son, that I've reported, and then I get that survey, and then to see the data, like, oh, there are actually more people having these issues. It's not just him. Like, it is kind of reassuring to when you're talking to your doctor about the difficulties they have. So this is the website. If you don't know it, is to get onto the data collection program. So if you've already enrolled, you can log in. If you haven't enrolled yet, you get started. If you forget your password, which I do all the time, I promise it's a really simple way to be able to reset it. And then once you log in, just as if it's been a little while since you've logged in, they will ask you to re read the consent forms. They just want to make sure that you're informed about what you're sharing the information for. And it will also prompt you before you can get to the dashboard to finish that head to toe survey, because really our goal is of the individuals who are enrolled in the program, we really want to see 100% enrollment, because truthfully, that's where the data comes from. We're so grateful for families who have already enrolled, but unless we get the data, it's really not going to be, it doesn't quite help. We need the information from you. So let's see. So these are probably things you've seen on our social media recently. Each month we kind of pick an area of the head to toe survey to highlight, as it also coincides with our awesome podcast that Ben does. And so we have been really focusing a lot on the brain and nervous system recently, because of attendance at an upcoming neurological conference. But there's also a really wonderful, this tile in the middle is on our website, is actually a movie, a little video. And one aspect of the, excuse me, one aspect of Rare X is that you can actually upload a genetic report. And again, they de-identify everything. So if you were a researcher going in, if you wanted to get genetic information from a genetic report, they don't give the researcher your full genetic report with your information on it. So they just take out that specific information you need, and then it would be given it to them completely de-identified. So you can upload your genetic report, which is incredibly helpful. Danae and I have actually gotten several emails recently, researchers and different biotech companies interested in the different genetic mutations for our community. So having that information would be really helpful. And so keep a lookout for these tiles that we have on social media, because we really try to make sure that if you're putting this data in, what are we finding from this data? Like the spotlight on behavior, 61 people completed the behavior survey, and these are the top 5 difficulties: anxiety, depression, mood difficulties, impulsivity, short attention span. It's definitely, we want to make sure we highlight these different areas. And then genetic testing, what is it? What are the benefits? Why would we get it? Because we know some of our older patients have been diagnosed based on their biochemical rather than a genetic diagnosis. So the question is, should you then go back and get genetic testing? So those are kind of the benefits of it. And then lastly, we have, like I alluded to before, Ben is one of our what are they called? HCU heroes. Thank you. Sorry, my brain wasn't working. He's one of our HCU heroes, but he also does a fantastic podcast. I've been a guest on it, and thankfully he does such a great job asking questions and getting really thoughtful answers. So these are our upcoming podcasts. Curtis Coughlin, he's going to talk a little bit more about genetic testing and genetic reports and the ethics. He's a professor, associate professor, and clinical ethicist, I can never say that, at Colorado Children's Hospital, and also Joy Brown. But make sure these are the different ways that you can listen to his podcast. They really are awesome to learn more about members of our community. So I'd encourage you to listen to that. I drive a lot in the car when I'm taking Grayson to and from appointments, and I just feel like I live in my minivan sometimes, and I just will pop one of these on, and I really love listening to them. So I think oh yeah, one more. Never mind. I'm not done yet. So these are 3 awesome research grants. You probably would have either gotten an email or seen them on social media. We wanted to highlight them again. So we have awarded 3 classical HCU research grants. As you can see here, the first is to Dr. McLean here in Colorado. We also have Tomas. I can never say his last name. Majtan.
I think it's matron. I don't know. So we'll
Okay.
guess together.
Yeah, Tomas. He's wonderful. Also, he's in Switzerland. And then our third is actually our first HCU grant that we've given to a biotech company that they're working on um, that enzyme treatment. And here is the lead investigator as well from Syntis Bio. So we're very excited about this research. It's really the reason we can give these research grants is because of all of the community members who help us fundraise and donate and our research race for research every year. So it's really incredible that we were able to do 3 research grants this year for the class.
This is 50,000 per piece. So we are so thankful for our families because we are finally to this point where the ball's finally really rolling and gaining traction, and we can't be more thankful. And it's pretty cool because Tomas, this is his second chance receiving a research grant, and Dr. McLean's. It's like,
Well, and it's really exciting because we gave them those original research grants. Now here they are building upon that and getting closer to providing treatments for our families. So it really is just steps towards better treatments or improving the quality of life of patients. So
there's a little Easter egg about what's to come. And it's so I would encourage you to read Ken McLean's press release because there's some very exciting news that we're not supposed to talk about, but he talked about. So I would encourage you to go read his press release because there's some exciting news that will affect our actually not just the classical homocysteine, but the cobalamin community and MTHFR community as well in there. So really encourage it. They're short, they're like a page long. All right, what's next? Let's see, Brittany, what do you have in store for us?
it's my computer to set. So I'm very excited. So Danae is headed to ACMG, that is in Los Angeles, and um, one of our medical advisors, along with Danae, have prepared an awesome poster using the Rare X data, and that's the title is right down here: Impact of Homocystinuria on the Brain and Nervous System. And so they'll be presenting that during the poster session at ACMG. And that's the Academy of Clinical Medical Genetics. So that's a big range um, of individuals and professionals at that conference. And then up here on the left-hand corner, this is kind of, I wanted to put this on here as kind of an example of what a poster might look like that we use for this data. So this is a poster that we're making mini posters for a conference called that the American Academy of Neurology that Danae and I are going to in San Diego. And so it's the incidence of neurocognitive symptoms in patients with homocystinuria. Again, really highlighting the brain and nervous system right now. Obviously, since they're neurologists, we want to show all of the different symptoms we have, highlighting behavior and psychiatric symptoms, the brain and nervous system, and showing that it's within the top 5 difficulties that our patients are having. So these will be little mini posters. We're going to print them out like 12 by 12 little flyers. That way we can talk to more. Oh, you printed one out. That's cool.
Oh, this is another one I have.
Oh, I was like, you printed one. That's so pretty. But yeah, there's a lot of Travere sometimes does that. There's a lot of other um, people that will print them out that way. So we'll be having that as well. And then very exciting that I will be attending ICIM. It's the International Conference of Inborn Errors in Metabolism, and that's in Kyoto, Japan. That's the end of September. So you probably have seen some of these tiles or open office hours on social media. I really have been trying to push and encouraging and requesting, pleading, begging maybe a little, but really encouraging our community to enroll in the Rare X program. And if you are enrolled, to complete that head to toe survey because it's called a data poll. So I'll be requesting the data from Rare X on March 15th. And I'll be using that data to write, again, another poster abstract for this conference, which is very exciting because this is not just the United States, but this is going to be an international contingency of metabolic specialists. So really highlighting that we have an international community of data and just the complications and difficulties that our community has. So keep an eye out in the future. Once we can publish those or show them to the community, we can share those after the conference. But if you're watching this and you have, again, any questions about RareX, you need support, just walking through the different questionnaires, whatever, you can email me. It's in the chat, research@hcunetworkamerica.org, and I'm so happy to help navigate that with you. So I think that's
Sorry, I
about it.
remembered. I talked to you, Brittany, and mentioned having Kim, the both of you do a webinar on the data that we share. So you'll be able to see it and have it presented to you in a digestible nuggets, because sometimes what we put out for them is not digestible nuggets. So I thought it would be a really great opportunity to be able to follow back up. I strongly believe, I was leading RareX until Brittany took it over, and I it's not just myself. Brittany believes this, our entire board does, but the importance of giving back the information that you guys contribute. And so because the ACMG and the American Academy of Neurology and ICIEM are such gigantic conferences, I feel like these are really great opportunities to bring that data back and hear it from the experts. So we'll be working with Kim and Brittany to find a time after ACMG and AAN to bring that data back to you. So be on the lookout for that.
Yeah, and again, I mean, the reason and the ability that we have to present these posters at these conferences is only because of the patient community that have already utilized and completed surveys in RareX. So we're incredibly grateful for the time that individuals have already spent in doing that, because I mean, all of this information, every single bit of it, all of these graphs that I can make, these cute little brain head pictures that we have on the posters, all of it is because of the RareX program. And truthfully, we couldn't do it without the patient community. So I'm incredibly grateful that people take the time to do it.
Thank you. All right. Fundraising, we're almost done. Quick recap here. There was a couple of fundraisers that we hosted. We had one in conjunction with Panda Express for Lunar New Year. And so we were able to raise $131. That's actually double of what we've done the past 2 years. So we are so thankful for our community that came out and represented. You can see the orange states there are the states that participated. And then I'm going to do the middle one last because this one's extra special. The football squares, we were able to raise $900 to benefit HCU Network America through the Super Bowl. And I want to say thank you to Tom, who's on our fundraising committee, for taking and leading that, because I don't do well with squares. I'm still confused by the whole thing, and he does it very well. And this is a very special fundraiser. So Tom's niece, Katie, had a birthday in, I think it was January. And the way she chose to celebrate it was by hosting a dance fundraiser for her two little cousins, Virgil and Annie. And so, not going to get emotional, but it's so incredibly sweet. And so, her and her dance team worked together and developed a whole series of dances. This is the legit program that they put together, and they were able to raise to $2,800, which I have to say, I think Kate turned 12. She's not very old. But it just is one of those examples, like, you don't have to be an adult. You don't have to to do something so amazing. And so I thought it was just such a fantastic way to bring awareness and to raise funds for the community. And we are just so incredibly thankful for Kate and her parents helping kind of orchestrate all this. And what a fun way to pay tribute to your cousins. And then we wanted to recap kind of our end of year giving because we were just at the tail end of that. We did not meet our goal in for the end of year match, but we were really close. We got to 91%. So we raised 22,931. So we were only really a couple $1,000s shy. And then this was matched by a couple of anonymous donors. And so we're really thankful. And during this campaign, we also highlighted a patient story of Chris, and he was on the podcast. He came with us to a conference, not him, but his story came with us to a conference for hematologists. And he also was our HCU hero. I think it was in October or November. Another fantastic patient story and podcast that I would really encourage you to take and listen to. It's amazing kind of seeing all these different facets and being able to pull them together, not just for awareness and storytelling within our community, but with also in the professional community. So what's next? March Madness. We encourage people to put together this kind of fundraiser. I think Ben Massengale did one last year. But we've had some other people put together them in the past. So if you are a basketball fan, this might be your deal. And then there's sorry. Oh, got a little click happy there. There's a website here, runyourpool.com, that has a bunch of examples that are helpful too. And this graphic also has some other suggestions. And then we are looking for people to join our fundraising team. Our fundraising team is incredibly important. We really have two main fundraisers during the year. We have in our spring big fundraiser is our World Homocystinuria Awareness Day one, WAD, as it so lovingly spells out. And then in September is our Race for Research. And so this was last year's. I love putting together both of these events. It gets a lot of creativity and just really both are fantastic opportunities to pull our communities together. But I think what's really important to remember is at the end of the day, these fundraisers are what really help our programs happen. And so our Race for Research, as Brittany was saying, is what funds our research grants. So the more money we raise during the Race for Research, the more funding we can put into research and hopefully, get better therapies across the board. We get so many frequent calls from families who can't afford the current therapies, or they're just really not super adequate to begin with. And so we're very hopeful for the things that we have funded, but patients need options, and right now we don't have those. So your contributions are greatly appreciated. Additionally, World Homocystinuria Awareness Day. I know I backtracked here a little bit, but that is coming up in May. And so we will have our live stream with our panelists, which is our awareness side, but there's a fundraising component. So we are putting together some really fun baskets. There's definitely some different ones this year, which I'm really excited about. And what's really important about World Homocystinuria Awareness Day, so it doesn't just fund our programming that allows us to kind of do our community outreach. We send out new family kits. Liz puts those together and they have like a printed copy of the guide. It's got one of our little plush gorillas. It has shaker bottles. It has cooler, so many different things that help set families up for success when they're just getting started, or if a family or a patient is returning to care as an adult. We send those out. So that's part of what that funds. But I think one of the most rewarding things that it funds, this is a little bit selfish on my end, but is our conference. And last year at our conference, because of funds we raised the previous 2 years, we were able to provide 10 scholarships for families to attend our conference. Our conference is free. There is no registration, but it does cost families a lot of money to get there. So we help try to offset the hotel and the flights. And so we were really honored to be able to provide 10 different scholarships to families. And so, as incentive for World Homocysteine Awareness Day, our we have an anonymous donor that will match. It's either $5,000 or $10,000. It's on the other slide, and so it's it's a really great opportunity to help get families here. This past year at our conference, we had just under 200 people. The year in 2022, we had 175. And then prior to the pandemic, we were at 125. So our conferences are growing at an accelerated rate, which makes the demand for these kind of conference scholarships even greater. We're expecting about 250 people at our next conference, and we will be announcing that location and having a save the date in May. So be in tune. But we would love more support with our fundraising committee. Currently, it is myself, Grace, and Tom. We had one other person and they had to take a leave of absence. So we're hoping they'll come back when they are able to, but we are a very small but mighty team. So anyone who's interested, we would love to have you. You don't have to actually go host a fundraiser. We just need more brain power and more tech power too. So and I think that is our last slide. So I'm going to stop the recording.